Could your hypermobility be affecting your mental health? If you've ever wondered why you feel anxious or overwhelmed more often than others, your joint flexibility might actually play a surprising role. Today, we're breaking down the connection between hypermobility and anxiety, what's happening inside your body, and most importantly, what you can do to feel more in control. So, what's the connection between hypermobility and anxiety? There's actually a strong connection between hypermobility and anxiety. It's more than just the stress of dealing with pain or injuries. Research shows that people with hypermobility, whether it's from conditions like Ehlers-Danlos syndrome, EDS, or hypermobility spectrum disorder, HSD, they're significantly more likely to experience anxiety. Why? It might have to do with the way your body's connective tissue influence not just your joints, but also your brain and nervous system, autonomic nervous system to be exact. In a way, hypermobility doesn't just affect your body's movement, it also seems to affect how your brain processes stress and anxiety. Now, how does autonomic nervous system dysfunction play a role? In people with hypermobility, the autonomic nervous system often doesn't work as smoothly as it should. This is called dysautonomia, where your sympathetic and parasympathetic nervous system don't regulate each other like they should. This can lead to symptoms like racing heartbeat, especially when standing or moving, feeling lightheaded or fainting, difficulty regulating body temperature, and of course, increased anxiety. When your autonomic nervous system is out of balance, your body is basically stuck in fight or flight mode. Even small stressors can feel overwhelming, and this constant state of alertness can lead to chronic anxiety. So, are hypermobile people more prone to stress-related disorders? Yes, absolutely. People with hypermobility are not just more likely to experience anxiety, they're also more prone to other stress-related disorders like panic attacks, which can be triggered by the body's exaggerated stress response, depression, PTSD. This was rather interesting because some studies suggest that hypermobility might even increase susceptibility to trauma-related disorders. So essentially, it's a combination of physical, neurological, and emotional factors that create this increased risk. The good news, understanding these connections can actually help you take control. Now, what techniques can you manage anxiety for hypermobile individuals? Regulating your nervous system with techniques like deep breathing. I love biological breathing. Meditation and grounding exercises can help calm your autonomic nervous system and bring your body out of that fight or flight mode. Progressive muscle relaxation can be especially helpful for releasing tension in the body. And what I tell my patients is to lay in a comfortable position on the floor and try to scan their body with their brain. See what is where, and they get to see where the tension is. And by breathing biologically, they get to relax these areas, which I've done in the past for biological breathing. If you have not seen it, if you have not subscribed to my channel or social media, you may want to join me so you get a nice flow of information and do-it-yourself type of videos coming to you frequently. Biological breathing itself is a great way to increase that inner thoracic pressure right here, which helps with increased heart rate, which is so common and one of the things that happen when we get anxious. So what you want to do is you want to breathe in through your nose and think about your lungs expanding. So place your hands in your armpit area, not armpit, just below your armpit, and just hold them inward and not so far in, but try to breathe in through your nose and push these thumbs away from each other. That's an increase in intrathoracic pressure, which puts pressure on the heart and decreases the heart rate, which when it's increased causes anxiety. So that's just one portion of it. Then you have to think about your abdominal abdominal diaphragm going down this elevator shaft as you breathe in. So you increase your inner thoracic pressure, and then later as this goes down in the same process of breathing in, you're increasing your inner abdominal pressure. So those same thumbs go down to your sides and you want to push them outward as you inhale. Next is exercises like dynamic neuromuscular stabilization, or DNS, which can improve your body stability and reduce symptoms of dysautonomia. These are exercises that we've learned by studying human babies. We all have gone from being infants to running toddlers without going to a gym, using resistive bands or weights and things like that. Those same exercises are in fact what I do with my patients to get them out of pain, condition their body, and stabilize their joint. The next thing is strengthening your core and joints to reduce physical stress, which can indirectly lower anxiety. And again, the safest and most effective exercises are those that we did automatically as babies because we are hardwired that way. So I'm not saying go isolate your area, your body part, and strengthen it. I'm saying do these developmental exercises, which are highly effective. I can't emphasize that enough. Prioritize your sleep and stick to a consistent bedtime routine. Since most people with hypermobility have neurodivergence, mostly ADHD, and are more of a night owl, set that timer to go to bed, not to get up, and perhaps use white noise or weighted blankets if you can tolerate the weighted blankets. Staying hydrated and eating small balanced meals can stabilize your blood sugar and improve symptoms of dysautonomia, which helps with managing your anxiety. Foods rich in magnesium and omega-3 might be a good support for a calmer nervous system. Working with a therapist to understand basically how chronic conditions work can help you learn coping strategies and reframe negative thought that may occur, those patterns you recognize and know how to manage them. Build your support system, which can include friends, family, even online communities where you can connect with others who understand what you're going through. If you found this video helpful, please like, subscribe, and share it with someone who might benefit. And if you have any questions or your own tips for managing anxiety, drop them in the comments below. I'd love to hear from you. And remember, we are all learning from each other. This is something that is not being taught in schools. So all of us who are treating patients with hypermobility, EDS, HSC, whatever, joint hypermobility, we are all learning these things from our patients. So if you have discovered things that have worked for you, this is a great opportunity to share it with the community. Thanks for watching, and see you in the next one.